Hello, and welcome to the webinar entitled Transitioning to the New Healthcare Qualifications and Apprenticeship Standards in England Update. My name's Geraldine Donworth, and I'm the Industry Manager for Healthcare and Childcare at City & Guilds, and I'll be delighted to take you through this presentation. We're going to cover quite a bit today, looking at the qualifications which are on programme qualifications for the apprenticeships in healthcare. We'll have a very brief overview of the apprenticeship reform. We'll look in some detail at the healthcare support worker, senior healthcare support worker and healthcare assistant practitioner apprenticeships. We'll have a look at how City & Guilds can prepare you for delivery and preparing your apprentices for endpoint assessment. I'll refer to the City & Guilds terms and conditions for endpoint assessment, and I will take you through an apprenticeship journey. Let's first have a look at some of the existing qualifications that can be used in the healthcare apprenticeships. We have a number of options which can be used for the healthcare support worker standard, although there's no mandatory qualification in that standard. The two qualifications I'm going to describe to you now are optional. So we have a Level 2 certificate in clinical skills and also a Level 2 award in medical terminology, which we deliver in partnership with AMSPAR. Those two qualifications can be added to the apprenticeship should the employer choose to do so. I'm also going to talk to you about a new qualification which has the same option. The following Level 3 diplomas have been reopened temporarily to capture any registrations required for the Senior Healthcare Support Worker Standard at Level 3, which was reissued in February. So we've opened the Diploma in Mental Health Care and the Diplomas in Clinical Healthcare Support, Allied Health Profession Support, the Diploma in Maternity and Paediatric Support, and the Diploma in Perioperative Support for a short time to allow any apprentices who were signed up or started in January to allow them to register for their particular qualifications. Now that the new standard for Level 3 is published, however, apprentices must be registered on the new Level 3 Diploma in Healthcare Support, and I'll go through detail about that qualification shortly. Another existing qualification within this apprenticeship suite is the Level 5 Diploma for Assistant Practitioners in Healthcare, and again I'll go through more detail shortly. First, looking at the certificate in clinical skills at Level 2, the qualification details are there for you on the slide. And to achieve this qualification, apprentices must complete 4 mandatory units and 5 optional units. The qualification has been designed so that the mandatory units are assessed together by a synoptic assessment, which City & Guilds supply along with a marking guide. Optional units are assessed using a portfolio of evidence, which must include observation of practice in real work settings. And information can be found on this qualification by clicking the link on the slide to the 3051 webpage. This slide details the information regarding the mandatory units of the certificate in clinical skills. And the following slide shows the optional unit themes, which you can see are a range of clinical skills. Moving on now to the award in medical terminology, this is a 1-unit qualification with 6 credits, which could enhance your healthcare offer. It's a 45 guided learning hours qualification, which is assessed by externally set and externally marked test. The tests are paper-based at the moment and are available 3 times a year, but we do have the potential to move those online should demand dictate that. Again, more information is available on this qualification on the 5519 webpage. Let's have a look at some new qualifications. I referred to the Level 2 Diploma in Care as being one of the optionals requirements for the Level 2 Healthcare Support Worker Standard. And I've already mentioned also the Level 3 Diploma in Healthcare Support. Looking at some more detail around the Diploma in Care Level 2, it's open for registrations and it covers both adult care and health. It replaces Level 2 qualifications in healthcare and also in health and social care, and it's endorsed by both Skills for Care and Skills for Health. This is an optional qualification for the Healthcare Support Worker Apprenticeship Standard. There are more details on this qualification on our 3095 webpage, and the version 1.1 January 2018 is the current version of the qualification handbook. But we'll have a look at a little bit more detail. This qualification is a 46 credit qualification, with 24 credits coming from the mandatory units, and a remaining 22 credits can come from the optional groups, which are B and C. We've split the optional units into competence-based units and knowledge-based units, and there is a maximum number of knowledge-based credits that can be used in the qualification to ensure that the balance is right in terms of competence, because this is a competence-based qualification. We'll also be having a unit route which will be available in March, and within the handbook there is a short list of barred combinations of units. Here are the mandatory units for the Level 2 Diploma in Care. You'll see here that the content and some of the titles will be very familiar to you if you've used the previous QCF diplomas. Our Diploma in Care optional units, as I've said, are split into competence-based units and knowledge-based units. I've listed here a number of themes. These are not necessarily unit titles, but just to show the coverage that's there in the optional bank. Moving on to the Diploma in Healthcare Support at Level 3, this qualification is endorsed by Skills for Care. Skills for Health. It's open for registrations and it replaces a number of QCF diplomas in healthcare. We will have a unit route available in March, and more details are available on the 4345 webpage. Version 1.1 January 2018 is our latest edition of the handbook. This qualification is a mandatory component of the Senior Healthcare Support Worker Standard and is structured in such a way that it has 65 credits, 45 which must come from the mandatory group of units and 20 credits from the optional group. The optional units are very varied and there are a lot of them. This is because in the Senior Healthcare Support Worker Standard there are a number of options, and we'll look at those in a few minutes. Out of the 65 credits, 37 must be at Level 3 or above. Here's a list of the mandatory units which are in the Diploma in Healthcare Support. These again will be familiar to you if you've used the previous qualifications. The differences are that there is a Unit 300, which is a study skills unit, and this has been specifically written to support apprentices in the senior healthcare support worker role and to prepare them for future study or higher education. Other additions to the mandatory group would be units like Understand Mental Health Problems, Understand Mental Wellbeing and Mental Health Promotion. And these have been mandatory for apprentices through use of the SACE framework in the past. As I explained, there is a wide range of optional units for the Level 3 Diploma in Healthcare Support, and this is to allow coverage of the 6 different options within the standard. So we have adult nursing support, mental health support, children and young people support, which is new to this healthcare suite, allied health profession therapy support, theatre support, and maternity support. There is a document on the 4345 webpage which has been produced by Skills for Health to support deliverers and apprentices to look at the varied options that they could take to support each option within the standard. Assessment of the new Level 3 qualification needs to be in line with the Skills for Health assessment principles, and observation of practice in the workplace and expert witness testimony should be the main sources of evidence for the competence units. As far as Unit 300, which is the Study Skills unit, is concerned, City and Guilds have devised a centre briefing for the assignment to allow the centre to design an assignment which the learner will complete. The assignment should be based on a topic that's discussed and agreed with the employer to ensure relevance, but also to get buy-in from the employer and also make it more interesting for the apprentice so that they're really contributing to some research and recommendations that will impact on the quality of service delivery within their healthcare setting. There needs to be both primary and secondary research activities, and the result of that activity needs to be summarised in a report which needs to consist of 1,500 words. The report needs to be structured in a certain way, and information on that is provided in the assignment guide, which is provided by City and Guilds. There's also a marking scheme available for assessors. The guide is password protected, can be found on the 4345 webpage, and the password is available on the walled garden. Just having a quick look at the Level 5 qualification, the Diploma for Assistant Practitioners in Healthcare. We've mapped this qualification to the Healthcare Assistant Practitioner standard, and there's a really good match to it. We've provided an evidence log also, which is on our webpage, to support an apprentice to identify those small gaps between the qualification and the standard to ensure that they've fully met the standard. The qualification appears on the Skills for Health website. We've declared it as meeting the standard, having done the mapping exercise. The qualification consists of 120 credits, 108 of which needs to come from the mandatory units. A minimum of 5 credits must come from option group A1 and a minimum of 7 from option group A2. Assessment is by portfolio of evidence for the competence units and externally set assignments for the knowledge units, one of which needs to be completed under controlled conditions. Again, there's more information on this qualification on the 3576 qualification in the qualification handbook. The mandatory units are listed here. We're going to move on now to having a look at more in terms of the actual apprenticeships themselves. This slide summarises the apprenticeship reforms, one of which is to give employers control of designing the apprenticeships, hence the trailblazer groups that were set up. And there's also a link on this slide to a 25-minute recorded session by one of my colleagues, which will explain it in much more detail. Summarising the healthcare standards and where we are with those at the moment, there are 3 standards that we're talking about today: the healthcare support worker, Senior Healthcare Support Worker and the Assistant Practitioner in Healthcare. For all three of these standards, there are standards published and published assessment plans. I'd like to draw your attention to the fact that the Senior Healthcare Support Worker standard has been revised and republished in February of this year, along with an updated assessment plan. The main change, as I think I've said, is the inclusion of the new Level 3 Diploma in Healthcare Support. As far as endpoint assessment goes, City and Guilds are on the register for endpoint assessment organisations for all three of these standards. And at Level 2 and Level 3, our endpoint assessment products are well on the way to production, and they have qualification numbers there in the right-hand column. Our Assistant Practitioner in Healthcare endpoint assessment product is now in development. This slide summarises the funding changes following the closure of the SACE frameworks and indicates the funding band for each of the standards. Let's have a look at the Healthcare Support Worker standard in a bit more detail. I've already gone through the on-programme elements which are available through qualifications if the employer chooses to take that route. Otherwise, an on-programme needs to be delivered over a 12-month period to allow the apprentice to successfully pass through the assessment gateway. This is measured by the apprentice achieving the 15 standards as outlined in the care certificate, achieving Maths and English at Level 1, and also attempting Maths and English at Level 2 by sitting the test. And that is a funding requirement. Also within the gateway could include an optional qualification. And in the last 3 months, a portfolio of evidence needs to be completed to go forward to be assessed as part of the endpoint assessment. Other elements of the endpoint assessment include a multiple choice test, the assessment of that portfolio, observation of practice in the workplace, and an interview. Looking at the Senior Healthcare Support Worker standard now, the on-programme options actually are different in that there are the 6 options. So the apprentice needs to decide which option they are going to take, and that will obviously depend on where they work and what their employer's preference is. There is the mandatory qualification of the Diploma in Healthcare Support, and although the assessment gateway requirements are similar, they are different, and it's important to take note of that. The care certificate is still a requirement, although if it's been achieved prior to the apprenticeship, then it stands. Level 2 Maths and English are required, and achievement of the Level 3 Diploma in Healthcare Support. In the last 3 months of the apprenticeship, a learning journal must be completed. City and Guilds will be providing more information on what the learning journal needs to contain in our endpoint assessment pack. There is also information within the standard itself. The endpoint assessment for this standard constitutes a multiple choice test plus 4 short answer questions. Observation of practice in the workplace, the assessment of the learner journal, and then an interview. All methods contribute to the overall grade, and each are graded pass, merit, or distinction, apart from observation of practice, which is pass only. Healthcare Assistant Practitioner standard is different again. We have a mandatory qualification in there, which would be the Diploma for Assistant Practitioners in Healthcare. The assessment gateway requirements includes the care certificate, Level 2 Maths and English, the qualification itself. In the last 3 months, a reflective journal needs to be created by the apprentice, which again will go forward into the endpoint assessment for assessment by the independent assessor. The other elements are a multiple choice test plus short answer questions, observation of practice in the workplace, and an interview. The example on the screen now is showing the grading grid for the Senior Healthcare Support Worker Standard. You can see that it is quite complicated, and we're hoping to make this very clear for apprentices to understand what their outcome would be based on their grade for each element of the endpoint assessment. Let's have a look and see how City and Guilds can prepare for delivery and for preparing learners for endpoint assessment. We've tried to summarise different aspects of this support on this slide. We'll be providing sample test papers, for example. We have an excellent Maths and English offer to support apprentices to achieve their Maths and English. We're carrying out a number of CPD events, one particularly around preparing your apprentices for endpoint assessment, which is proving very popular. We have our qualifications as either mandatory or optional, enhancements such as the AMSPAR medical terminology, and our endpoint assessment preparation tool, which is new, and I'll talk about that in a moment. The next 3 slides show the timeline of events for each of the 3 standards that I've discussed today. This will indicate when we'll have our products ready, when you can make bookings for endpoint assessment, when sample papers will be available, for example, and when we expect the first endpoint assessment visit to be able to take place. The timelines are slightly different for each of the standards because they're at different stages, and I'm sure you'll be able to have a look at these in your own time. I'd like to explain our pricing to you for endpoint assessment and for on-programme. So for each of the standards, we have qualifications options. At level 2, the healthcare support worker, I've already explained that the level 2 diploma is care is an optional qualification. The on-programme price for that is the normal qualification price of £100. Endpoint assessment we have priced at £410. The way that our pricing works is that there is a £25 registration fee, and then the remainder of the fee would be invoiced following the first assessment when the results are entered onto our systems. We've also included prices for resits, so the test would be £15, the portfolio assessment would be £100, and the observation and interview together would be £295. The Senior Healthcare Support Worker and the Assistant Practitioner in Healthcare, I'm working on the prices now and they're to be confirmed, so we'll keep you informed when we've finalised those. Again, this is a summary of the funding allocation for the apprenticeships. And this slide and the next slide show the way that our pricing works. As I've explained, the EPA registration fee is upfront when you decide that your learner is ready to be registered for endpoint assessment. We would recommend that that was done quite early on in order to take full advantage of our endpoint assessment preparation tool. The next stage would be to make a reservation request so that you know then the learner has gone through the gateway and you want to make a date for their endpoint assessment events. The event takes place and then the balance of the payment would be made. Similarly with resits, the reservation request would be made, the resit would take place, and then the balance would be paid at first result. We have produced endpoint assessment packs and are producing endpoint assessment packs for each of our standards. These will include information on roles and responsibilities throughout the process, guidance on how to evidence the gateway and also how to send evidence to us, instructions on guidance on how to book endpoint assessment, and then more guidance around what a portfolio or a learning journal or a reflective journal should look like, how they'd be assessed, and which bits of the assessment plan or standard are covered by each of these elements. There's also information about how to set up a professional discussion, the sort of things you need to think about, and what kind of arrangements would need to be made for a practical observation. We have a different endpoint assessment pack for our independent endpoint assessors. This will obviously contain much more information around marking and grading criteria to support the assessors to make a consistent and fair and reliable decision. Now having a look at the endpoint assessment journey step by step for an apprentice. If we start in the top left-hand corner with the recruitment and induction of the apprentice, moving on through the registration process, through the qualification process and the on-programme. Then if we're looking at box 5 on the right-hand side, you would make a reservation request for endpoint assessment following successful gateway. And at that point, our endpoint assessment team makes contact with you as our customer to confirm dates and also how to collect or for you to send information that needs to go forward to the endpoint assessment. Once the evidence of the gateway is received, the endpoint assessment can be booked and take place. City and Guilds would then process the results. On success, we would issue a statement of achievement, which would be issued to the training provider or employer. And then the endpoint assessment team forwards the results to the ESFA for the apprenticeship certificate, and the certificate then goes direct to the employer. This next slide is a summary of our endpoint assessment preparation tool, which is an online portal for apprentices to work through short, sometimes snappy pieces of learning to support them to prepare for their specific endpoint assessment activities. There's more information on the endpoint assessment preparation tool at this YouTube video, which is about 2.5 minutes long and is narrated by one of our apprentices. The endpoint preparation tool is available to any apprentice who registers with City and Guilds once that registration fee of £25 has been paid. And our endpoint assessment team will help your learners to get set up to access this tool. In order to offer endpoint assessment through City and Guilds, existing centres would need to complete the form at the link shown here, but new centres or customers would need to complete a different form as we have no existing relationship with you. Our manual for endpoint assessment services can be found at the link at the bottom of this slide. Let's have a look at a couple of next steps. We are welcoming applications from individuals who would like to be independent endpoint assessors. I've taken an example of some information from our person specification, which is on our website, for the Senior Healthcare Support Worker Standard. And the link to make that application is at the top of this slide. If you'd be interested, we'd be delighted to hear from you. The next couple of slides are giving web links to information on our apprenticeship site, where you'll find a whole host of really helpful information. And here are some individuals who may like to contact: myself, Geraldine Donworth, and my colleagues Susie Gray and Paul Rowbottom, who are our technical advisors. In order to keep up to date, we'd like you to register for our email updates. And for more information on the standards or for endpoint assessment, there are addresses there for you to use. I'd like to thank you very much for listening to the webinar. We will be posting the slides on our website, along with answers to the questions that have been raised during the webinar. So thank you very much. Goodbye.